Okay. Hello and welcome to Wellness Wednesday Live. And we are excited to be here today to talk about the topic of mental health. And this is National Mental Health Awareness Month. And so we've chosen that theme for Healthy You. And so all the programming that we're doing this month kind of addresses that mental health piece and ways that we can improve our mental health, work on our mental health, and also some educational pieces. And so we have a guest here today to kind of talk about a very serious issue. This is Beth Singer. She is the grant coordinator for the Zero Suicide Grant at Cary Medical Center. How are you today, Beth?
Hi, I'm good.
Awesome. Why don't you tell us a little bit about the Zero Suicide Initiative? What is that? Is that a national thing? Is it just a local thing that we made up? Or tell us a little bit about what it is.
Yeah, no, actually, it is a national program, and it's a partnership of health organizations across the country who are working to really implement better strategies and provide more training and resources for healthcare providers and mental health providers, so that we can meet our goal, which is essentially zero suicides. So, like at Cary Medical Center, one of the things we want to do is we want to find out what are the resources that we have, what are things that our staff and providers need in terms of training, what are some things that we can do to better support them so that they can better support our patients who come in who might be contemplating suicide or dealing with some very serious mental health issues.
And speaking of mental health, what kind of mental health conditions impact this suicide discussion?
Well, there's so many different things that can impact, somebody, really thinking or, contemplating suicide. Our brains are very complex and there's so much that's going on with our brains. And so some people might have, depression, anxiety, bipolar, schizophrenia. And usually it's a chemical imbalance or something that's wrong that's in your brain. And so that's one of the things with this is we want to try to also kind of help change, the stigma around mental health, because you're not going to tell someone, who's maybe having heart trouble, oh, well, just, it's okay, just buck up, or we're going to, think positive and your heart will be better. It's, if someone is depressed, there's something that's going on chemically in their brains, and they sometimes can't see past what's going on, and they need, medical intervention. And it's not a weakness. It's not something that is something to be ashamed of, and it's something that we need to be more open in talking about it. And even with more severe mental health issues like schizophrenia, people might actually hear voices and hear someone telling them, you aren't enough, you're not worth it. And then that's when they start really thinking about and having that ideation of suicide. And so these are the people that we're trying to reach and help. But then also there are some people who might not have depression all the time, but they might go through a period of depression, especially like women with postpartum depression, or, if someone just lost a loved one or something like that, they might go through a stage of depression. But it's not something that you can just, sometimes just, be positive and get yourself out of it. You really, that's when we want people to, to talk to a therapist, or to, sometimes there are medications that can help, but it's something that we really don't want people to be ashamed of. And we really want people opening up and talking about it.
Awesome. How prevalent is this problem here in Maine or even Aroostook County?
Well, I was looking at the data, and unfortunately, I don't have specifics for Aroostook County, but I do know in 2018 in Maine, about a little over 200 people committed suicide or died by suicide. And
I feel like that's probably a lower number too, because I don't feel like it's always documented accurately. Would you say?
It's not, and we are, in terms of national statistics, Maine does have a higher rate of suicide than the national average. And then one of the things too is we are seeing an increase, and has been kind of a steady increase over the years. And you do you think a lot of times about with suicide being younger people, especially now, more teenagers and even younger children. And it's something that, we want to make sure that, we're addressing this and talking about it. But also, there is a group that's kind of missed, and that's older adults. We see that a lot of older men, especially over the age of 70, who die by suicide. And that's something that we, also want to make sure that, we're reaching out to these people, whether it's, they feel isolated, or might be a medical condition that they have, or sometimes a spouse dies and they just, might feel that they have nothing left. And, and we don't want people to feel that way. We want to make sure that people understand that no matter how old you are, that your life is valuable and that there are people here who want to help.
Mm. And I feel like in Aroostook County, we're so spread out geographically to begin with that it's very easy for people to get isolated. And then we look at the current situation that we're in with this pandemic and these stay-home orders, and how much more so people are feeling that isolation and possibly not reaching out where they could and should and really do need to. So what kind of resources are available right now? I mean, we're all kind of on lockdown, working from home, you and I today. What's available for people who are struggling with these thoughts?
Well, right now, because one of the great things about the Zero Suicide Initiative is that we're part of this national listserv, this email resources, and we see what's going on throughout the country. And telehealth is, is really big right now. And being able to do something like this, a video chat or even a phone call, with, a mental health specialist that you can talk to. But especially if someone is truly in crisis, we don't want them to wait. You can call to Maine's 211 number, and they can, connect you with someone who might be able to help. But the crisis hotline is 888-568-1112. And that's a number that I know a lot of people who work in this field just have memorized. And that is the true crisis number. And what they will do is they will connect you with people here in the county who will they will respond to you, and they'll make sure they will, if they need to, they will come to your house. Because even though we have this 6-foot separation or a physical distance, we aren't going to we don't want to separate ourselves emotionally. And that's something that we really need to be reaching out to. And then also on the Cary Facebook page recently, and then we can also try and post again, and also on Age Friendly Caribou, were some phone resources. Like AARP has a phone a friend. The Sheriff's Department here in Aroostook County has a phone program where older adults can sign up, and someone from the Sheriff's office will give them a call just to check in and say, hey, how are you doing?
I love that. And I think that that's a great prevention tool, for this terrible thing that could inevitably come from that isolation and that distancing for long periods of time. I think that's awesome.
Yeah. And it's, we have to think about too, a lot of people up here, their only time of getting out and being social might be when they go to the grocery store or when they go to get their hair cut or something like that. And that's really been limited recently. And then I know we've been under stress, and things are it's so much harder for everybody. And it's one of the things that I'm concerned about. And I know a lot of other people are very concerned, because we are, probably going to see even more of a spike in suicide because of what's been happening. I was just on a conference call where there was a psychologist from Italy, and he said that the rate of suicide among healthcare providers has dramatically increased over there. And so we want to make sure that we are checking on each other, that even if it's just a friendly hello to, someone at the store, or, calling your neighbor or calling a friend, we don't want to, to miss that opportunity to just, say hello and, make sure everybody's doing okay.
Yeah, and I think that that's important that they've kind of made the shift from that social distancing to physical distancing, as we should still be remaining socially connected. And it's amazing to go to the store and just you see these, I was walking into Save-A-Lot in Caribou this morning, and this gentleman just started chatting me up. We're putting
Yeah.
on masks as we're getting out of our car. And he says, oh, can you even believe we have to wear masks? And this is
Yeah.
we live in. And and I was thinking about the discussion that you and I had the other day about this, I don't know that man, that might've been the only interaction he had. So I tried to be cordial and carry on the conversation as long as I could while we were walking in and grabbing our carts to be counted. But, that it's so important. And that's something that all of us can do just on a daily basis. I know, especially, we're all frustrated. We're all dealing with these limitations in our lives. And so those limitations have not been put on us by, the guy walking into the grocery store next to us. So there's no reason to necessarily take it out on those people, on other people. We're all in this together. We're all dealing with our own struggles, and we're all kind of dealing with it in our own way. But as much as we can, kind of be that light in the world, and remember that your interaction with people may be the only one they have that whole day. Especially when we talk about some of these folks who are confined to homes or limited on how, even more than we already are, on how they can get out.
Yeah. And then also, I don't want to miss out on the opportunity to, kind of give a shout out too. We have a lot of great providers here in the county. AMHC is a great resource to reach out to. They have, crisis, intervention. They have people that you can talk to. There are other, I know other organizations and groups throughout the county, just whether they provide, just talk therapy, or they can help you with, medication, or, if needed, that crisis services. We do have that here. And so we don't want people to not pick up the phone if they need it.
For sure. And they can even start with their primary care provider if they're not in that crisis kind of a situation. And their provider, who might be more familiar with their background and even more of their history, would be able to potentially give a referral to whatever is necessary. So when we are, I guess, just to kind of round it out, how can we know if we're struggling? Like, a lot of times you hear about someone who has taken their own life, and the parents are always like, I had no idea, or the neighbor, my goodness, I didn't even know the person was struggling, or they were working and doing life and it looked normal. So, like, how do we know if someone is hurting in this way?
Well, I guess you have to pay attention to sometimes the subtle hints. They might start to lose interest in some of the activities that they used to do. And of course, now it's even harder because stuff you couldn't, like, we can't go out. And, but, maybe they're just, you might notice that someone just isn't calling as much, or they're not, interacting as much on social media, or, they're kind of self-isolating on more so than we are because of, the COVID-19. But also they might even start talking a little bit about, oh, life would just be better if I wasn't here, or, wanting to die, things like that. Just is kind of, it's off. It's like something's not right. And also, they might be seeking a means, someone who maybe doesn't own a gun is suddenly asking about, how do I get a gun? And, or they're asking about different things. You're like, why? That's when you want to start bringing up and asking some of those questions. Well, why are you looking for this? And is it, they want to take up hunting, or, maybe they, feel the need for, protection in their home. But,
Security.
yeah, they might, you just start asking the questions, and,
And I
also,
think it's important to say you're listening for what they
yeah,
say, but also what they don't say.
yes,
And that
yeah,
can sometimes be tricky, because I mean, if people are really seriously depressed, I mean, some you don't even really recognize it until it's so overwhelming that, they're either confronted with it by someone who's witnessing it, or
yeah.
just so overwhelmed with it that they finally get to that dropout bottom place.
Yeah, and then like with the mood swings too. Sometimes you might find that someone who maybe is depressed, and they're going through some of those motions, and they have lost a little bit of interest. Maybe they're sleeping a little bit more, but then all of a sudden they have a lot of energy and they're going out and they're doing, like, oh wow, they must be feeling better, or something's really changed in them. That's
Mhm.
actually a warning sign. Usually it's because they have come to the conclusion that their only way out is suicide. And so then they suddenly have this sense of relief, like, oh, it's going to be over. And so then they are feeling happier and they are feeling better, because it's like a weight has been lifted. And they might start giving away things, especially something that's special to them. They might
Mhm.
start talking a little bit more about wills or things like, making plans for, end of life. And that's something that, and it's hard too, especially if you're talking with someone who's maybe 75 years old. And of course, they're going to probably be planning, some end of life stuff. That's, in some ways is a smart thing to do. But also, if it's suddenly a shock, like, wait, why are you talking about this? And
Mhm.
don't be afraid to ask a question. And if you really are concerned about someone, do not be afraid to ask them, are you, thinking about suicide? And you're not going to put the idea in their head. More than likely, if they are, the idea is already there. That's kind of a myth, where people are like, oh, we can't talk about it. Or like, oh, are you thinking about hurting yourself? And like, that's not, no, you need to come right out and say, is this a problem, and are you thinking about suicide? And if they do say yes, you ask them, do you have a plan? Because that's when you know it is very serious. Because if they have a plan and they know how they're going to go about it, that's when you need to call that crisis line. You might even need to call 911. You don't want to leave them alone. And someone else, though, if they don't have a plan, that's when you can probably have a little bit more time. You definitely want to call the crisis line, but you also, want to be there to listen. And I know it can be hard, but you're not there to judge, and you're not there to be angry with them. I know, because it's hard. Like, if I was to go to someone and they're like, yeah, I'm thinking about suicide. And you might feel angry, you might feel frustrated, like, why would you want to do that? And you don't want to ask them that. You don't want to say, why, or you have so much to live for. And that's not going to help the situation. What really is going to help is you being able to sit there and listen to them, and truly listen, without interjecting a lot of your own thoughts and feelings. Because right now, they're not able to see clearly. There's like a fog around them. And the way that they're thinking is very different from what someone else might be thinking. And so they're not sitting there thinking how it's going to affect everybody else. If they are, they're probably thinking that, oh, it's going to be huge relief, I'm no longer a burden. Or they're not, it's not really rational. And so it's something that to them it is rational, but to us it might not be.
Mhm.
So if you don't think that you can really sit there and listen to someone and be non-judgmental and be able to give them support, maybe find another friend who can. Because you don't want to, if you are pushing back in some ways, we don't want them to feel like they're not being heard. And we want to make sure that they get the support and help that they need.
For sure. And we'll make sure to do a subsequent post to this video to kind of put some of those links out in the forefront where everybody can access them and know where to kind of get in touch with you to learn a little more about this initiative. That's awesome. So anything else you want to add, or I think you've covered a lot of great things.
Yeah, I just want to say, don't be afraid to talk about it, even with children that are younger, because they're seeing it, they're hearing about it, and so it's something that we want to make sure that we're having, good open conversations about it. If you're not sure how to talk about it, then that's when you might want to reach out to a professional or someone who can help. And just remember, for anybody out there that is struggling, your story isn't over. And get help.
Sure. And we will provide some of those links below. Thank you, Beth, for your time. And just remember, you're not alone.
Mhm.
Wants to help. We're here to help. And even if we don't know anyone who's struggling, we can still just be a little bit of joy and a little bit of light just by having those positive interactions with everybody that we encounter throughout the day, because you really just honestly don't know what anybody is struggling with behind the scenes. So as much as we can be that light, we really should. So thank you, everybody. We hope you'll check back in with us in 2 weeks for our next Wellness Wednesday Live. We'll continue on the topic of mental health. Have a great day.